And so I'm going to get started as we allow people to continue to roll in and load in, but I want to be respectful of everybody's time. So again, this is Bob Luz from the Massachusetts Restaurant Association. I want to thank, first of all, our panelists, I'll introduce in just a second, for their time and efforts today, but everybody else's time to be here. This is now our fourth webinar that we've had in terms of the reopening process. And, you know, as we know, we continue to inch closer. We don't have definitive plans just yet. But the outline of the reopening process has been presented to us. And we're just lacking that ever key date, which we anticipate getting on Saturday. The first webinar was on basically getting our restaurants ready from a sanitation level. The second was in terms of operationally trying to think through a lot of the procedures and steps we needed to go through to get operations back up to start phase. The third focused on sort of the human resource elements of it, the legalities and the compliance that was necessary. And then today we're going to focus on, you know, on architecture and how to best manage space. I mean, and really, and again, because we now have the blueprint for the reopening of the restaurants, it becomes even more important. So today we're going to focus on that piece. Boston-based Mass Design Group started in 2008. A couple college roommates, Alan Ricks and Michael Murphy from Harvard Business School, got together and really started to talk about the lack of educational and public health infrastructure in the developing world, and they've been using architecture to create impact ever since. Most recently, the firm examined how spatial strategies inside and outside of your restaurant can diminish the risk of COVID-19 and reinforce the trust that is key to this whole reopening process between our internal guests, our employees, and obviously the public, the external guests, most critical, or just as critically, if not more critically. So today's presenter is Caitlin Taylor. Caitlin is a registered architect and design director for Mass Design. She studied at Wesleyan University, received a Master's of Architecture from this little school down in New Haven called Yale. And she's taught advanced architectural studios at Yale School of Architecture and Columbia Graduate School. Again, pretty good firms, pretty good schools, and previously worked at firms in New York and New York City and Connecticut. And in addition, joining her is someone that's well known within the restaurant world at large here in the greater Boston area, Jody Adams. Jody obviously has a long history past, first over in you know, one of those other schools, Harvard, over in Cambridge there with Rialto, and then most recently, obviously with a series of restaurants, Trade, Porto, and Saloniki, covering sort of the whole spectrum of the restaurant industry, if you would. And she's a great friend of the Massachusetts Restaurant Association, great supporter, and a great spokesperson for our industry. So really pleased to have this group together, and I'm going to pass it off to you and let you, Caitlin and Jody, take it from here. And again, thank you very much for being here today, folks.
Thank you, Bob, and all of you out there. I'm not sure who you all are because we can't see you, but it's good to be here.
Yeah, thanks everybody so much for having us and for joining us today. We're thrilled to be presenting some of this work to you all. So as Bob introduced, my name is Caitlin Taylor.
Caitlin, can I jump in 1 second? Because I did forget to do something which is important, and I apologize before it goes too far.
Yeah, sure.
Folks, as you have questions, as they come up here, please use the Q&A function in the tab, as opposed to the chat function. That That will make things go a lot better. And again, Caitlin, I apologize. I forgot to say that before I handed it off. Sorry.
No worries, that's important. And I'm excited to field questions at the end. So thanks for clarifying that. So yeah, as Bob introduced, I'm an architect at Mass Design Group and I lead our Food Systems Design Lab. I'm so thrilled to be joined today by Jody Adams, who, as we know, is well known around Boston for running Porto, Saloniki, and Trade. And we're just thrilled to be here this afternoon to share a bit about the work that we've been doing to address the spatial and infrastructural implications of COVID-19, of this global pandemic on the restaurant industry. So I'm going to start today by spending just a couple minutes telling you a little bit about our organization and our work around the world and why we are a part of this conversation today, and then jump into an overview of the work that we've been doing to support the restaurant industry since the broad national and international shutdown in March. And after I introduce our work, I'll ask Jody to share a bit of her experience operating Porto since the shutdown, and then use the work that we've done together in collaboration as an example of how we've been applying quick design thinking to case studies in order to provide transferable examples for other restaurants as you consider reopening on this uncertain timeline. And I'll leave plenty of time for questions at the end. So my goal for this webinar is really to provide an introduction to how we as architects look at the spaces of restaurants and understand their potential challenges and opportunities in light of the current and rapidly evolving, ever-changing understanding of how this coronavirus disease is transmitted. And in doing so, to provide you all on the phone with the tools you need to see and understand the spaces of your restaurant in new ways. So just again, to quickly introduce who we are at Mass and the types of things that we work on. Mass Design Group, we're an international architecture and design collective. We have offices around the world, including our largest office and first office, which is located in Kigali, Rwanda. Our US-based offices are here in Boston, in Poughkeepsie, New York, and in Santa Fe, New Mexico. And we're a big interdisciplinary team of architects, engineers, landscape architects, planners, writers, researchers, and all of our work is focused on the mission-driven belief that every design decision about our built environment, whether that decision is made actively or passively, has real systemic impact. So at the most basic level, we approach all of our work with the responsibility to harness the systemic impact of our design decisions in service of designing justice, dignity, and beauty into our built environment. And we believe that this global pandemic provides a really galvanizing moment for architects and other designers of the built environment. The entire origin of our firm's work, of Mass's work, is in designing hospitals and healthcare facilities in remote and under-resourced areas of East Africa. So we have a long history as a firm of designing buildings that, that participate in a healthy environmental prevention of disease transmission. So for example, this project that you see here on the screen, Butaro District Hospital, designed for Partners in Health in Rwanda. And this entire project was designed around the question of how buildings can make people healthier instead of making people sicker. So by moving the circulation to the outside of the building and designing for passive airflow through the patient care spaces, disease transmission is minimized in clinical settings. And we've also designed spaces and buildings specifically to prevent other diseases as well, like this building is in Haiti, designed to prevent the spread of cholera. And this project is under construction in Liberia right now. It's a big hospital designed to prevent the spread of Ebola. So as the scale and severity of the COVID-19 pandemic was becoming clear to all of us in real time in early March, we at Mass felt uniquely prepared and called to action to offer something from our experience, not only to hospitals and healthcare institutions, but to other industries as well. So our goal was and remains to bring our experiences in designing projects around the prevention of disease transmission to bear on the unique and complex challenges of understanding how our buildings and our infrastructure can make us sick or make us healthy. So just a super quick background, one of the first things we did in response to the pandemic was to work quickly developing a hospital case study with partners at Mount Sinai. This work was focused on real-time remote observation of spatial strategies that were being deployed by doctors and nurses during a rapidly evolving crisis. And so our observations about on-the-fly redesign of hospital spaces, so things like designated hallway space for putting on PPE that was clearly labeled, or improvised negative pressure systems in each room, led us to one, among many other things, led us to one really simple and widely applicable conclusion, which is that applying idealized infection control guidelines to real life contexts with real life constraints will always result in adherence gaps and adaptations. So as we dive deeper into this work and understand its broad applicability across lots of different building typologies and across lots of different industries, we are building on infection control principles learned in that context and others that design for 3 scales of disease transmission. So we understand those 3 scales to be at the scale of a person, so behavior change and personal controls, things like PPE and social distancing that we've heard an awful lot about in the last few months. At the other end of the spectrum is the design of organization and operational control, so things like limiting capacity in restaurants and limiting hours, staggering occupation, crowd management, designing one-way flow through big spaces, things like that are at the organizational or operational scale. But then there's this middle scale, which is the design of building and environmental controls that we see is really critical and largely missing from a lot of the protocols and conversations that are happening, or recommendations that are being issued today. So we'll look at all 3 of these scales as they relate to our overall spatial analysis of restaurants. So why did we make this document and publish it on our website as an open source free resource and as a living document? What we observed in the rapidly unfolding crisis in mid-March was that there were basically no spatial guidelines or principles that existed that helped connect the evolving and sort of iteratively issued protocols and guidelines for things like food safety and worker safety with a viable business model. So we didn't see any guidelines that would help connect the personal or behavioral scale interventions or design challenges with the organizational interventions or design challenges. We know that dining out won't look like it did before this pandemic, and we know that the operations of your restaurant won't go back to normal, pre-pandemic normal anytime soon. So one thing that we hear again and again as we talk to people in the industry is that there are so many different guidelines being issued which address worker safety and food safety and sanitation protocols. But these mandates or these guidelines have physical, infrastructural, and spatial implications on your business model, on the way that you can run your restaurant, that need to be addressed. Those are design challenges that need to be addressed in order to connect a reopening strategy with the actual constraints of the spaces that you have. So there are a few baseline assumptions underlying these observations and recommendations that I just want to make sure are super explicitly clear before we run into, dive into our case study with Jody at Porto. The first baseline assumption is that as much as I would love to identify some single clear architectural fix for how to reopen restaurants safely and quickly across the board, we approach this work with the understanding that there really is no one-size-fits-all solution. Because every space is different, every solution will be different. The second assumption is that we present all of this design thinking within a rapidly changing understanding of how the coronavirus, how COVID-19 is transmitted, what its transmission pathways are, and what its patterns of transmission are. So as the evidence about disease transmission changes and evolves, so will our work. And we know this, and thirdly, we know that these guidelines are not always feasible within the constraints of existing restaurant spaces. Adherence gaps and design hacks will both be necessary when applying these ideal recommendations to real world constraints. And we acknowledge that up front. So as a way of introducing the main takeaways of our restaurant guide document, Jody and I will quickly talk through our process of developing this case study. So I'm going to pause here for a second and ask Jody to jump in and describe the work that she and her team have been doing since the shutdown in March. And then I will describe the process of our quick spatial analysis in a little bit more detail. So
Great.
Jody, go ahead.
Thanks, Caitlin. I just also wanted to make the connection that I have with mass design. The first slide that you saw of the hospital in Rwanda and Butaro, that hospital did not exist pre-2008. And I was in Rwanda with Michael Murphy looking at that site. So, and I just went to see it for the first time in February. In fact, it was like COVID-19 entering when I came back. I've also seen the work in Haiti, the cholera clinic in Haiti. Mass Design does amazing work around the world, and we're really, really fortunate to have them here, putting a spotlight on restaurants here in Massachusetts and then beyond. So as far, what we did right on the, I think it was the 14th, is we closed our restaurants before Governor Baker actually made the announcement that we would have to close on that Tuesday. And we shut all the doors. We then subsequently opened Saloniki, one of our Salonikis in Fenway, for to go. And about 2 weeks later, we started our Gives program at Porto. And we worked hand in hand with Off Their Plate, which, as many of you may know, was started by a Harvard medical student, Natalie Gao, who galvanized a bunch of her colleagues and started a feeding program for frontline hospital workers. So our team has been working at Porto, cooking 300 to 400 meals a day, as have a number of other restaurants around the city. It's been an amazing experience and program. And what it required of us early on was to look at our processes, and Off Their Plate developed a very pretty clear set of guidelines, working with Tracy Pang from Pagu and Ken Oranger, who were the first restaurants that, and I think Irene at Mei. And so their guidelines, in conjunction with World Central Kitchen, are the sort of the gold standard now. And it has to do with the flow of people coming into the restaurant, temperature taking, where people put their belongings, changing their clothes. And those of you out there who have started doing to-go takeout are working with organizations like Off Their Plate and doing these kinds of meal program already know about these protocol, but I think Caitlin will talk us through the process, and you'll see how helpful it is to have it broken down spatially. Because we know, as restaurateurs, we know how to take care of guests, how to keep people safe in terms of food safety and slip and falls, and all the things that, tips training, all of the things that we have been doing forever, and to ensure that our guests are safe. This is something new and big, and something that we don't know a lot about, and the understanding is changing daily. So we really need some help.
Great. Yeah. So as the industry and all industries were shutting down in mid-March, Jody was one of my very first calls, because we were sort of asking ourselves internally at Mass what on earth we could do to help. As I mentioned in my introduction, we had a lot of experience with the relationships between space and airflow and infection control, and we wanted to bring that experience to the places, the people, the partners, the industry where it was needed most. So as everybody was making everything up as we were going along, nobody knew what tomorrow held. We designed a really quick and pretty scrappy case study process. Jody tracked down the old drawings from when Porto was built not too many years ago. And we drafted up a quick set of guiding questions for what quickly turned into really resourceful Zoom walkthroughs, basically a virtual tour of the restaurant. And some of the, we tried to organize our questions and our analysis in a couple of categories. So understanding the ways that the spaces of the restaurant had been used before the pandemic broke out. So what types of spatial sequencing already worked well or didn't work well maybe, what the pre-COVID capacity and operations were of the restaurant, what the response had been since the shutdown, so what they were learning in terms of adherence gaps and design hacks for operating with off their plate as they were doing day to day, learning as they went. And so some of the questions that we asked and talked about and discussed and messily sketched over on Zoom annotation feature were things like how many seats you had pre-COVID and what type and in what configuration. Where do employees typically enter the restaurant? Do they arrive in uniform or do they have a designated space where they change into their work clothes when they arrive? Where are employee hand washing stations located relative to the entrance, the exits, relative to where food and people come into the restaurant? What is the visual interface between the kitchen and the dining room? Is it open, visible? Is there a lot of airflow between the two or not maybe? And then in their COVID response, what have you all been doing? What has the team been doing since the shutdown to reorganize operations around an entirely new process, as Jody said, but also new and rapidly evolving requirements and protocols to ensure food safety and safety of employees. What are the sort of midterm goals? We wanted to understand what we were designing for. Given the fact that the future is and was very uncertain, we wanted to understand whether returning to pre-existing operations was even a goal, or to transition to new models of dining, or to continue to go back to private or sit down meals, or try takeout only. These were all questions that we wanted to be open to the possibilities of. We asked about designating an exchange zone in the restaurant, which we'll talk about in a minute, and if so, where it was and how that had worked. We wanted to know about how the team had been handling deliveries, whether there was anything different about the way deliveries were being handled now than before the pandemic. We wanted to understand how the team had been mitigating risk when transporting food from the loading dock, which in this case is shared with other businesses and residents, through the shared elevators and into the kitchen. That's of course a spatial question. How food and people move from one place to another is inherently spatial and architectural. We wanted to understand whether there were opportunities to potentially expand seating in order to maintain social distancing according to rules that were coming out at the time, but while maintaining the same number of seats or close to the number of seats that the restaurant had before the pandemic. And of course, we wanted to understand, at least at a basic level, how effective the interior airflow, ventilation, mechanical systems were currently operating. We talked a little bit about existing pinch points in COVID operations. So, particular places on the floor plan in the design of the restaurant where 6-foot social distancing was difficult or impossible. We talked about what the barriers were to rebuilding customer trust that the team perceived in reopening. Are there unique barriers that are specific to Porto? Are there more general barriers that apply to all restaurants? These are some of the things that we talked about. So the result of this process, this scrappy Zoom case study walkthrough process, was meant to be quick and actionable. So it's a spatial analysis of flows of people and food through the space at 3 snapshots in time. Pre-COVID, the current operations with off their plate, and then future reopening for potential dining in the restaurant. And we made some discoveries about creative design hacks that Jody and her team had been developing on the fly. So for example, using the bar as a plating and packaging station. And one of my favorite examples in all the conversations that I've had in the last few months with restaurants, the Porto team was using the vestibule as a place to pass off orders that were boxed orders that were being picked up. It was a clear, transparent, visible, one person size, environmentally controlled exchange zone, basically. So we've been widely publicizing that as a great example that other restaurants have been picking up. So as we talk through the 5 main principles outlined from the guide, I first just want to really quickly reinforce what I think is a really important point, which is that restaurants are already really good at these things. And I keep telling everybody that I talk to outside of the restaurant industry that they have a lot to learn from the way restaurants have been and will be handling this, this crisis as it unfolds. So all the industries across our economy are going to be looking for creative and resourceful ways to rebuild trust, to reoccupy and redesign safe indoor spaces, and to recalibrate to new business models. And I think we all on this call probably believe that the restaurant industry can and will lead as an innovator in those things because, you know, as we all know, restaurant people are some of the most creative and resourceful folks around. So with that in mind, I'm going to quickly talk through the 5 main guiding suggestions from our document, and then I'll happily invite questions. We'll answer questions for a few minutes before we wrap up. So, the 5 guiding suggestions from this document start with the need to evaluate new and evolving food safety and sanitation protocols as challenges in the actual spaces of your restaurant. So as I mentioned briefly earlier, it's not enough to issue idealized protocols that are devoid of real world constraints. We have to actually think about the way that these food safety and sanitation protocols take up space and affect the spaces of the restaurant. The second is that the way you use the existing spaces of your restaurant will change. So examining the existing spaces of your restaurant with flexible, agile, and quick reconfiguration in mind is a really critical next step for organizations, for groups that are thinking about reopening. The third is that the 6-foot rule of thumb doesn't take into account the nuances of different types of seating inside a restaurant or the airflow conditions or the spatial configuration of that restaurant. So we have started here in this document, but plan to continue more careful analysis that we think is required in order to understand how restaurants can and should reopen with safe social distancing, but with the understanding that not all types of seating are created equal when it comes to the proximity between diners. The fourth point is that we believe that restaurants play an outsized role in the street life of our cities and in our communities. So we believe that we have a responsibility to give the space of the public realm back to restaurants as they expand outdoors. And I know we've probably all seen a lot of great examples of that. We'll look at a few here in this presentation, but you know, we really want to advocate for that as a strategy, both for the viability of our restaurants and for the vibrancy of our street life as we all relearn how to be in public spaces together. And the fifth point is that designing for trust between staff and customers is going to require careful and deliberate design at multiple scales. Again, something that restaurants are already really good at, but we'll need to focus on in this next phase. So I'm just going to quickly talk about each of these points briefly, but and Jody, please jump in if I forget anything important. But I also
if I could for just 1 second,
Sure.
I have been thinking, you know, when this first came up and we first started talking about this, it was super overwhelming for me to think about how are we going to think differently about spatially about our restaurant and pathways and flow and zones, and it seemed like it was an impossible task for us to take on. As we've talked this through, and as all of us have lived through the last 10 weeks, we've become experts on so much of this. And it's become part of our vocabulary and part of the way we think. I mean, sometimes I find myself when I'm in traffic, I leave like 6 car lengths between me and the person in front when I'm stopping, thinking, for social distancing. So I have tremendous faith now in our ability as a population, as human beings, to adapt to this. And I think there will be some things that will stick with us, and I think there are some things that are going to fall away. And we've already we are already seeing a shift, I think, in people's mentality about this, as it seems like things are loosening up a little bit. We have to still be careful. But one of the major sort of thoughts that I've taken away in my conversations with you and Michael is this notion of trust and customer building for trust for the customer, but also we need to think about building for trust for the people who work inside our restaurants. And this spatial thinking and flow helps lay that groundwork, because if we are clear to our customers about what the expectations are, how they move through the restaurant, wearing masks, all of the signals, then we will be protecting our staff as well.
Absolutely, yeah. I think that's really important. So that obviously ties into all of the sort of nitty-gritty detailed stuff that we will skim through in the next few slides. But I invite everybody to, after this call, visit our website and review the document in more detail, read it, ask us more questions. But in the meantime, we'll run through it at a high level. So yeah, as I sort of put out there first, we understand, as Jody said, we understand these new food safety and sanitation protocols as inherently spatial. The relationship between the way that people and food move through the spaces of your restaurant can be examined at a spatial and sort of flow-based level, and therefore understand what's inherently safe or unsafe about those existing flows and modify them as necessary to manage for safe social distancing and mitigated infection control. So, again, we don't have time to go through all the details today, but this drawing is meant to show a sort of prototypical restaurant condition. So this is no one single restaurant. We offer these recommendations overlaid on top of this prototypical restaurant with the understanding, again, as I said, that the application of these suggestions is going to be inherently different in context specific ways that, no two restaurants are exactly alike. So no two applications of these guidelines will be exactly alike either. But we did want to provide some general guidance about, again, thinking about the flows of people, your front of house staff, your back of house staff, and your guests as it relates to the flow of food through a restaurant. So things like a designated entry for employees that is separated from guests is important. As a changing station or storage area can and should be provided, if possible, for employees to put on and take off their PPE when they are arriving for work. And again, this concept of the exchange zone to limit contamination is one that we keep coming back to and have been sketching over lots of different floor plans as we've worked with lots of different restaurants in this case study way the last few months. So designating space between the back of house, the service zone, and the front of house sort of public zone where the handoff of food and the sort of controlled exchange of people can be managed is really important. So then, of course, there are other things like the possibility of installing centrally accessible and very visible public-facing hand washing stations. This is something Jody and I have talked about a lot, the opportunity to ritualize hand washing in our communities and our culture is one that we think could be a really positive outcome from this pandemic. And we've also provided some information in this document about high-touch surfaces. So different types of materials. There's emerging research and changing research about what types of materials the virus lives on for longer or dies on faster, which materials are safer, which aren't. But so there's been a lot of conversation about that. But one of the things that we think is really important from a spatial perspective at the scale of a person is to look at the spaces of your restaurant and understand where the high touch surfaces are. Things like doorknobs, the chairs, the countertops, the soap dispensers, bathroom fixtures. These are all high touch surfaces. And of course, I know there's been a lot of conversation about phones. Phones are obviously one of the most high touch surfaces, and they move around the restaurant with you. So that one's a little bit harder to solve. We'd also like to just quickly look at the idea of examining the relationship between spaces with the possibility of rearranging them or shuffling them according to safe flows of people and food. So again, designating spaces where loading and unloading can happen that is clearly labeled and separate from other operations can be done with tape with really super simple things, scrappy and inexpensive or free things like putting tape on the floor to mark out a space where boxes are opened before food is brought into the kitchen. There are other visual cues as well, things like posters and signage that will help keep those areas visible and clean. As we learned from the work that Jody and her team were doing at Porto with Off Their Plate, the counter space, bar space, which might not go back to being used in its former way anytime soon, can be designated as part of the exchange zone between back of house food preparation and front of house food serving or delivery. So the bar can be used to prepare, package, and organize orders, and can be sort of used as a barrier to minimize contact between kitchen and customer. Ensuring proper airflow in the kitchen is really critical and an emerging question. This is one of the areas in which we in our work and everyone have a lot more work to do to understand what the options are for maximizing passive airflow, opening the windows, opening the doors, allowing fresh air to move through the space. Those things, that strategy has a lot of positive effects, and it has some potential negative ones as well. And those are, again, spatial and site specific. And yeah, I again want to reinforce the idea of the centralized hand washing basin as a sort of interface between the public zone and the exchange zone or the back of house in the restaurant. So this question of the 6-foot rule, which I mentioned briefly in my introduction to this section, is really just a rule of thumb. We understand it to be something that demands a lot more scrutiny from us as spatial thinkers, because we understand that separating all the diners in a restaurant by 6 feet in all directions is in many cases just simply not possible. The spaces of a restaurant are too small. It would limit capacity below a threshold for viable business model. So, there have been a lot of moves towards outdoor dining, which we'll talk about in a second, but we also want to sort of reinforce the fact that not all seating is created equal. So when it relates to social distancing. So we want to suggest a slightly more nuanced, a finer grain of detail in your analysis of your seating in your own restaurant. So, obviously, as everybody on this call knows, there are booths, there are tables, there are high tops and bars, there are banquet seating, and those things have different possible reconfigurations around safe social distancing. So again, the bar might not ever be used as bar seating, or might not be used as bar seating anytime soon. Nobody wants to sit at a bar 6 feet away from the person that they're sitting at the bar with, but there are other creative ways of repurposing the bar. And on the other end of the spectrum, booth seating is actually, by all sort of initial studies and estimates, seeming like a viable way of getting more people into a restaurant, as long as the barriers between the booths are high enough. So I'm sure everybody on this call has seen lots of good examples of plexiglass dividers between booths and other things like that. So here are a few examples that I'm sure everybody here has seen. I'm gonna go quickly through the last few slides just so we have 15 minutes for questions before the end. But you know, the second to last point is one that, again, I mentioned already, and I know that everybody on this call is probably familiar with and is advocating for in whatever ways we can. But I just really want to reinforce the fact that expanding the restaurant into the street is something that will benefit both our cities and our restaurant industry. So there's been a lot of amazing advocacy by a lot of different groups to local governments and policymakers about how to enact rapid zoning amendments to enable flexible, quick, easy outdoor use of space. But this is, of course, again, it's spatial and it's architectural. What outdoor spaces are available to you as a restaurant owner or manager is something that you know, each person, each organization will have to individually analyze. And I know we've all seen great examples of parklets and other creative ways of restaurants taking over the street for outdoor dining. And then the last point is, again, just designing for trust. And this is one of the things that the restaurant industry has always done very well. Things like Jody, in one of our first conversations after the shutdown, reminded me that the White Chef's Code is a way of designing for trust, that chefs wearing, you know, chefs and restaurant folks, people in the kitchen wearing white to signify that they are using clean and safe food preparation practices is a really great example of what a lot of industries will have to learn from in terms of clearly and succinctly communicating a trusting relationship between staff and customers. There are other things as well, though. Clear signage that explains new processes before customers enter a restaurant, really important. Sight lines between the kitchen and the dining room. Many restaurants have, some don't have, and can be very beneficial in terms of communicating safe food preparation practices. And I'm going to stop there, and I want to field some questions. I want to make sure we have 15 minutes for questions before we wrap up at 3. But that's what we've got so far. We have a lot more work to do. This work is really only just beginning for us. We are, you know, again, have developed this first document that we published on our website. It's meant to be a living guide, which we link to at the end of this presentation, and will be shared with you after the fact. So we invite input and questions, and the next phase of this for us is really to dig deeper with some of our case studies, expand our case study work to make the recommendations and the guidelines as widely applicable to as many people, as many restaurants as we can nationwide, as we all face this really uncertain timeline of how and when to reopen. But we know it's on everybody's mind, and are really happy to have had the chance to walk you through our initial architectural consideration of that as a challenge today. So I'll stop and get some questions.
Caitlin, thank you very much. This is Steve Clark at MRA. That was a fantastic presentation, and a number of people have been asking for the slides and for the case studies, and just want to let you know, they're on the MRA website as well under reopening resources, and Caitlin has just posted them as well, and I know someone has shared the link where they are available, so if anyone needs them, please dive into them because they are really good. We've had a number of questions come in, so I think now is a good time for some questions. The first one is, you talk about the importance of airflow in some of your designs. What are some other things that restaurants can do to improve airflow in their existing operations?
Yeah, it's a great question, and it's a tough one. So, you know, I am not a mechanical engineer. I do not design HVAC systems. I'm an architect. But with, you know, we understand as architects that there is a relationship between the mechanical system in a restaurant, like the active system that moves air, in the greatest volume, obviously through the hoods in the kitchen, but in other sort of general building systems as well. There's a relationship between those active systems and more passive systems, like opening the windows. So the impact that opening the windows, for example, as a passive solution to increasing airflow in a restaurant, the impact that that has is going to depend on the arrangement of the spaces in your restaurant. So it could be a really good thing to be moving more air through the space, which we all know at this point is really critically important to prevent transmission of this aerosolized virus. But in some cases actually can be harmful because it might basically, you can infect people downwind. So it's a little bit of an unsatisfying answer because there is no one answer to that question. It depends on the relationship between the spaces of your restaurant. But the sort of general takeaway that I want to reinforce is that the solution to safe and effective sort of maximize airflow through your restaurant is going to be a combination of active solutions and passive solutions. Active solutions like increasing the flow of your vents, for example, or adding filters to your existing vents to filter out the virus from the air. Those are active solutions, and passive solutions like opening the windows. And that the sort of viable solution for any one restaurant is going to be a combination of those things.
We don't
know, Jody,
know,
whether you had something to add there.
Caitlin, couple of things. One is that we don't know if the HEPA filters actually filtered the virus, right? That it might not filter the virus. We don't know. And the other thing is that you have talked about, and this is something that's, I would love to hear something from the CDC on this. And if anybody on the call knows an answer, that would be great. And that is, you know, there is a certain standard for air exchanges in a space as being the level for preventing infection, right? The WHO has a standard. Is it 12 exchanges per hour?
12 air changes per hour. Yeah, that's the unit.
Who knows what that means? I mean, we don't know what that means, right? Like, that could be a little or a lot. So we don't know. How do we evaluate the air exchanges per hour that currently exist in our spaces? Is it possible to do that? And we certainly need help on that, because who knows?
Yeah, absolutely. And that is very much our focus in the next phase of this work. So in the same way that this first document tried to outline some clear sort of spatial guidance for looking at the, the relationship between the restaurant and the way that people and food move through it, and the relationship between those flows, what was safe and unsafe about that, what the design opportunities were there. In the same way that that was the goal of this document, and the intent being to have restaurant folks be able to sort of self-evaluate, for lack of a better term, read the document and see their space in new ways, understand what some of the important questions were, even if they didn't know the answers right off the bat, figure out what questions to ask of their space in order to begin to think about operating safely. We're now moving into a second phase, which is looking at taking that same approach to the self-evaluation of mechanical systems and airflow in restaurants. So again, I'm not a mechanical engineer, but I know some mechanical engineers, and we're like developing these partnerships as we speak to try to be able to ask and answer some of the really critical questions about airflow in restaurants in the same way that we've done with like space in this first document, so that there's a set of questions that you all can ask of your existing system and understand what the primary gaps are, or what the like major benefits are of the system that you've got. So it's a really good question, and it's hard to answer.
I'm glad I chose that one first. That was a good question to dive into. So a couple other questions have come in regarding the Porto case study. Is this a permanent redesign or just a rearranging of the existing structure?
Rearranging of the existing structure. That's a sort of an idealized design without, because we were being so cautious about people coming into the restaurant. Caitlin did not come into the restaurant. It was all done virtually. I think there were some walls that were taken down that actually can't come down. But what we have done is we've definitely expanded our patio. And there's a question here about, I thought there was a question about patios. I mean, we've doubled our patio capacity. We're very fortunate at Porto to be able to wrap the patio around the building. And what we're asking questions, for instance, that where we are is a terrible wind tunnel at times. So we are thinking about plexiglass dividers, not just for transmission of disease, but for wind mitigation. And because the wind is great there, which means the airflow is going to be awesome outside on that patio, but it may mean that everything's blowing away. So
yeah, and I think the only thing that I would add to that is that this is sort of a conceptual point, but we're all living in this moment of real uncertainty where we don't know how the requirements or protocols are going to change over time. So we understand the reconfiguration of many restaurants to prioritize outdoor dining, especially obviously in our region, to be seasonal, right? People are not going to want to sit outside and eat dinner in the middle of the winter. So, we're attacking that seasonal question with the understanding that we have been blessed with a few months to try to answer those deeper questions about mechanical systems and airflow in restaurants for indoor dining in more detail. So I think that the question of whether a redesign is temporary or permanent is a little bit, I don't think there's a yes or no answer to that question, or it's not a black and white issue. No. Because right now we're designing for summer, and then we'll design for winter, and then we'll design for 2 years from now. And like each of those timescales remains a little bit indeterminate.
And I think every restaurateur is going to make a different decision. I know that what we're doing, because we have the ability to expand in the patio, is to not think about anything permanent inside until we have to make that kind of decision. It's so uncertain. There's so little concrete information. There's a question here as to whether or not will physical barriers between tables be required when reopening. We don't know that, do we? And how yes.
So there's a number of questions about barriers, and I was going to just kind of weave that in as one question. We do know that the recommendations say that that the state put out on Friday, that if a restaurant, in lieu of social distancing 6 feet, you're allowed to put up a barrier in between tables and customers where that's possible. So I was going to open up into a broader question around barriers and non-porous plexiglass. Is that something you have considered in some of your designs? Is that something that's out there that you have looked at from an architectural standpoint?
Yeah, absolutely. And I'm sure we've all seen photos of, even beyond plexiglass, some of the really creative and interesting solutions that some restaurants have been testing. So I've seen things like clear shower curtains hung from the ceiling. I've seen non-transparent barriers put up between booths, plywood, things like that. So there's obviously a range of a range of materials that any one restaurant can design around as they're considering seating, indoor seating. But again, you know, just the broader question of barriers in general gets back to the sort of the need to look at seating with a little bit more intention than just assuming that all diners need to be 6 feet apart. You know, that's of course a really important baseline, but we also understand that based on configuration and based on airflow, it's more complicated than that. In some cases, that's not enough space. And in some cases, it might be more than enough. So again, that's another thing that's going to be different. I warned everyone at the beginning that there's no one rule for all restaurants, but you know, that is something that we're looking at in each of these case studies very carefully.
Right, and we do have one question that's come in that talks about the inconsistency of weather in Boston, of whether people are on the patio and it starts to rain, what happens after we serve them? I think while we're still outside, the people are going to have to stay outside. I think the requirement is probably going to be to invest in some umbrellas or tents or what have you, but I don't think that the local boards of health are going to sign off on people coming inside restaurants because it rained in the next 2 weeks or so until we're authorized to actually be back inside. So.
Yeah, and the only thing I would add to that is that, you know, of course people don't want to sit and have their food get rained on while they're eating. That doesn't sound fun or delicious, but I do think that, you know, we in this moment have the ability and the opportunity to ask people to accommodate different experiences than they might have before. You know, like diners will understand why they are sitting outside and why that's safer for them. So, you know, all the conversations that we've been having, Jody and I have been having, I've been having with other restaurant folks suggest that, you know, we're going to have to be willing to design around things like the weather in order to, at least for the summer season, have folks sitting outside, and that customers will be willing to accommodate that.
Right, and we're right at about an hour, so maybe we'll have time for one more question. And you may know, I have not seen any in terms of requirements that the barrier must meet, except for that it needs to be 6 foot high. I have not seen any other standards or requirements set by the state that would require what a barrier what standards a barrier should meet.
No, I haven't either. That's a good example of a suggestion that's made in a lot of guideline documents that we've read that is not specific or universal, but because of the evolving understanding of disease transmission. So I think all of our hope would be that as the transmission of coronavirus is better and better understood in the coming months, we can get more and more specific about the actual requirements for things like barriers between booths. All we know now is that it's better to have it than not have it.
Correct. Okay, not seeing any more questions in the queue. I want to thank Caitlin for her wealth of expertise that she has exhibited on this webinar. I want to thank Jody for a very busy schedule of operating a restaurant in a COVID crisis for being and spending time with us today. This webinar has been recorded and it will be available on the MRA website, and we will distribute it out to a larger audience in today's alert. And the case study will be available as well. So not seeing any more questions, I want to thank everyone for joining us today and have a great day.
Thank you.
Thanks, everybody.